Reporting to the emergency department.
Tonight, doctors and nurses from the NHS go to war in Afghanistan, risking their lives to pluck British soldiers from the front line.
Water! No, you've got to wait till we get back, because they need an operation to sort your legs out.
Taking the heat from the Taliban.
This guy's bleeding out from his legs, and it comes to a point where it's very much limb versus life.
The fight to save a Royal Marine.
Let's stop and move him to the operating theatre.
What's the right thing to do?
There's no rush now. Are you happy with this guy's stability?
Who has the final call?
I don't want any surgeon chopping off my leg because that's probably the right thing to do. I want him to cut my leg off because it's the only option.
This is called a killing house. British soldiers under attack. A man's down.
2, 3, 4, 5, down, go!
The blood and injuries may look real, but they're not. This is an exercise involving doctors and nurses from the NHS. Volunteers who are going to spend 3 months at war in Afghanistan.
It enables us to create the kind of atmosphere and environment that would be going on with casualties, so that as close as possible our people can be challenged under realistic scenarios.
The wounded aren't soldiers, they're actors with special qualifications. They've all lost limbs.
Here for the first time we've got an individual that has experienced it, and sometimes in very traumatic situations, and so can deliver that realistic response that we're looking for from a casualty that's had a traumatic amputation.
For the amputee actors, the shocking bomb damage is all part of a day's work, even if you can't always remember exactly how many times you've lost your arm.
5 or 6 already. Probably got at least another 10 or so to go, yeah.
The excellent prosthetic work they use with their fake gore and blood, it does mentally prepare the people who are going to deal with this sort of thing, because if you've never seen someone's leg, you know, facing the wrong way and half hanging off, it can be quite shocking.
We're going to do a couple of pictures first to get you lined up and in the right place. Okay, the rest of you can compete together.
Simon Lawrence works in an NHS cancer hospital in Cardiff. He's used to dealing with traumatised patients. He also spends his weekends in uniform in the TA. And for the past 6 years, he's been given time off work to serve on the front line in Iraq and Afghanistan. This time, he's in Helmand province, helping to run the military field hospital at Camp Bastion. A £10 million state-of-the-art trauma unit, which deals with more than 2,000 casualties a year.
People's lives depend on our skill and expertise, and the troops that are out on the front line have to be confident that the medical services that are backing them up are the very best.
Lawrence is one of 100 volunteers from the NHS who are in Afghanistan. Many are on their first tour of duty.
I need plasma.
David Hawkins, a trauma nurse from Wales, is one of them.
I'm in it because I want to be in it. I want to do something to help support those other individuals that are given 110% on the front line. And if there's anything I can contribute in regards to medical care, then I'll do it.
The front line for Hawkins and Lawrence is the hospital. The closest they will get to the shooting war is cleaning their personal weapons.
We happen to be military medics, so we do some soldier stuff as well. But our job is to be medics, that's what our job is. If this camp came under direct attack, we'd still have a responsibility to look after injured people more than we would defend the camp.
And the injured are already on the way.
Chopper team to the emergency department. Chopper team to the emergency department.
Flying straight over the bad guy.
A military air ambulance is coming in from the battlefield. A soldier's being blown up by a landmine.
Captain Brown, ED.
Dr. Adam Brown is another volunteer. His NHS day job is running an emergency department in Bath.
Cheers then, bye-bye. I'm going to change that to a trauma call. That was the helicopter team. Apparently there's tourniquets on both limbs, all right? And they're landing imminently.
On board the air ambulance, a twin-engine Chinook helicopter, is a doctor and 2 paramedics and 6 armed men. It's their job to protect the medical staff and the casualty from Taliban attacks. The soldier is in a critical condition and needs surgery fast. Dr. Hugo Guthrie, Bastion's junior trauma surgeon, is ready and waiting. Guthrie's not NHS, he's full-time Army, a frontline doctor for 6 years.
We're a busy armed force at the moment, and wherever the soldiers go, the medical team has to go as well.
Bastion's a far cry from Dr. Guthrie's life back home in Portsmouth.
I've got a young family. I've got an 18-month-old daughter. My wife's pregnant with our second.
Major Guthrie's a self-confessed trauma junkie who's been on the Army medical book since he was in the 6th form. He's determined to reach the top of his profession.
The buzz in surgery is the act of doing something to put it right, something physical with your hands, where you put things that have been disrupted back together. And that's where I get my most enjoyment, but also my most challenge, because I'm still learning.
It's now Dr. Guthrie's job to save the life and limbs of the wounded soldier.
Okay, guys, let's get them across nice and gently on the monitoring, and then we'll just go top to bottom, okay?
Tourniquets coming off.
Blood loss kills many Allied soldiers, and that's Dr. Guthrie's first big challenge.
The biggest killer in military penetrating trauma is loss of blood. If you lose enough blood, you can't get oxygen from the lungs to the brain. You're going to be tested, to the level of your expertise and sometimes beyond that. And that's an exciting thing.
That's a clot.
Guthrie's next test involves the soldier's legs.
Can you feel this?
The landmine has done catastrophic damage to both.
Yes. Can you feel this? It's a yes or no. Can you feel this? Yes or no? No. We're trying to assess whether he's got a sensate foot, whether he can move it, whether there's circulation there. These are all just things to build a picture of whether the bones look unreconstructible. He's going to lose this limb, I think, anyway.
Dr. Guthrie now knows the soldier will lose his left leg, but there's still a chance he can save the other.
Regarding his right leg, we'll debride the wound, we'll assess it further, and we'll do our best to save that leg.
As they head for the operating theatre, the doctors and nurses don't yet know how crucial the coming hours are going to be. Landmines on the front line. Royal Marines with terrible injuries and lives hanging in the balance. In southern Afghanistan, British troops are moving against the Taliban, on foot and in armoured convoys. The soldiers know Taliban bullets and rockets aren't the only threat. It's landmines they must watch for. They don't always get them all. A mine has gone off under an armoured troop carrier with 3 Royal Marines inside. The medical emergency response team is needed. This is a bad one. Leading the team is Dr. Peter Davis, the Army consultant who works in the NHS in his spare time, on loan to a Glasgow hospital. He's a trauma specialist, and it will be his job to try and save the lives of the wounded men.
We've got a resuscitation room, an emergency room, in the back of the helicopter, and many of the life-saving procedures that we'd normally do in the hospital can actually be done while we're flying back to Camp Bastion. We're bang up to date with the latest advances in technology and in medical practice as well.
Dr. Davis knows this mission is like no other.
Don't wait for any orders, if anything is melting.
The helicopter is heading deep into enemy territory of the worst kind.
Traditionally, there'd been a lot of Taliban activity in that area, and the threat in daylight was always going to be high. There was the anticipation or the fear, and that's very real. On the way in, when I'm inactive and I'm waiting to pick up the casualties, I'm often quite scared. You know, there's a lot of trepidation involved.
In the hospital, the doctors and nurses are assessing yesterday's patients.
Azim is the chap who came in yesterday late afternoon, who was in a vehicle struck by a mine.
Dr. Guthrie didn't manage to save the right leg. He had to partially remove both.
He's had a below knee amputation on the left, and he's had a through ankle Symes amputation on the right.
For Dr. Guthrie, it's a chance to think again about the difficult choice he had to make.
You need to look at the overall status of the patient in terms of their stability, their overall stability, and then decide whether you can save this limb or not. You need to be able to look into your heart and know that you've made the right choice.
Making the right choice doesn't always sit well with the patients, and that's where the nurses come in. Azim's soldiering days are over, and the amputations leave him facing an uncertain future.
He wishes that he was dead. Yeah, which is really sad. So it's not the nicest of things, is it, for a young lad? But it's not a lot. You know, hopefully he'll come to terms with it. He's only 19, 20. It's really sad.
Azim is also in tears.
To have a grown man cry in his bed was heartbreaking, really, and he was only a young lad. He's the same age as my 2 sons, you know. And I think, again, you think on a mother's perspective, don't you, of, you know, no matter what nationality they are, you do feel really deep down thinking, oh, you know, it could be my children.
Sue James has been nursing for almost 30 years, but that doesn't make situations like this any easier.
The longer you do your nursing, I think it probably gets a little bit harder the older you get and the more emotional you get.
Azim won't be staying long. The rules stipulate he must be moved as soon as possible to another military hospital, codename Hero.
Pain is quite well controlled at the moment, and I think the plan for him would be for transfer to Hero. And there's no reason why he couldn't go within the next 24 hours.
70 kilometres away on the front line, Dr. Davis is almost at the scene of the landmine blast.
For you, the medics, yep, 3 times casualties at the moment.
News is coming in about the condition of the Royal Marines who've been caught in the explosion.
There's certainly one priority one under the Cat C.
One will die unless he receives immediate treatment from a doctor. Another is seriously injured. The third is already dead. Britain's policy of flying highly trained doctors to casualties on the battlefield gives the surviving Marines a chance.
I served in the Royal Marines for quite a few years, and I have a great affection for Marines.
Provided the Taliban don't shoot the helicopter down before it gets there.
As we flew in very low and very fast, some of the ground troops who were observing the aircraft mission actually saw the aircraft come under fire from a number of firing points.
That vehicle really has taken a big hit, hasn't it? It's in the 5 o'clock, it's still burning.
It really is initially a scoop and run, get them on board the helicopter as quickly as possible. The crew will then do their damnedest to fly away as fast as possible, and while they're flying away, we're in the back working on the patients.
All right, son.
The Marine needing do-or-die treatment from Dr. Davis is only 22 years old. He caught the full force of the blast.
First thing that we look for is any obvious massive bleeding from which the patient is going to lose an unsurvivable amount of blood.
His name is Peter Dunning, and he's just weeks from the end of a second tour of duty in Afghanistan.
We don't spare the horses, basically, in terms of what we put forward to try and bring these people back into the field hospital.
Dr. Davis knows this one's too close to call. Keeping Marine Dunning alive is going to take all the medical skills he has.
Marine Dunning was just about conscious. He'd lost a considerable amount of blood, and it was only really because of his great physical strength as a young Marine that he was able to hold on for as long as he did.
Water! No, you've got to wait till we get back, because you need an operation to sort your legs out, okay? You can't have anything to drink, mate. We'll get you getting plenty of fluid into your veins, and we'll get you sorted after the operation.
We can arrest further hemorrhage, but at the moment we can't replace blood and we can't operate on somebody, so we can't surgically turn the tap off.
The second injured man, Marine Goddard, also has blast wounds to his legs and severe burns to his left arm. But he's not as bad as Dunning.
You're going to be fine. We'll get you back to Bastion in about 5 minutes, all right? You're going to be fine, lad.
At Camp Bastion, the hospital is already on full alert. The surgeons must be ready to operate as soon as the Marines arrive. Everyone knows blood loss will be a major issue. And there's a storm brewing. A sandstorm.
It's probably like this maybe once or twice a week, I think. And this actually isn't too bad. You can actually see things. Normally it's quite dusty.
Lieutenant Jones has only been a TA volunteer for 3 years. She normally works as a physiotherapist at an NHS hospital in Glamorgan. This is her first time in a war zone.
What you look at every day is just this vast expanse of desert. If you're lucky and it's not too dusty, you can see the mountains in the distance, but that's not always the case. Everything's kind of desert colour. The tents are sandy coloured, what we wear is sandy coloured, so yeah, that gets a bit much sometimes.
The storm won't hold up the helicopter, which is just as well. While Dunning and Goddard fight for their lives, Dr. Guthrie, the duty orthopaedic surgeon, prepares himself for his ordeal.
That's fine, crack on, Wayne, thanks.
Not only is he going to have to perform life-saving surgery on at least one of the Marines, he's working with one of Britain's most senior and experienced general surgeons, Malcolm Loudon. A lieutenant colonel in the TA and a consultant who normally works in an NHS infirmary in Aberdeen, this is Dr. Loudon's 5th tour of duty.
The way things are, I'm probably going to stay in the background because we're expecting further casualty or casualties. Best if we don't tie ourselves all up.
Dr. Guthrie knows he's got to be at the top of his game if he's going to impress the man whose job he wants to have one day.
I'm still in training, and so wherever I go, there's always going to be somebody keeping a watchful eye over me and supervising me, so that when I go back and do it as the consultant, I can do it properly.
But Major Guthrie hasn't got time to worry about Lieutenant Colonel Loudon. Marine Dunning is his only concern now. The helicopter has made it. Dunning is still alive, and he and Marine Goddard will be in Bastion's ER within seconds.
There was a sense of, okay, this is why we're here. Now, you know, if there's a time to give, you know, this is it.
Dunning is still in a very bad way.
The patient in this case lost a massive volume of blood, requiring a huge amount of blood transfusion, anaesthetic support and painkillers.
His lower leg between his knee and his ankle was just blown to bits. There was just bone sticking out and everything, but his boot was still on.
35.924.
Dr. Guthrie cannot save Marine Dunning's left foot, and unless he can get more blood into him quickly, he might not be able to save his life either. As the doctors try everything they know to keep Dunning alive, Lieutenant Colonel Loudon is keeping a close eye on Dr. Guthrie.
This guy's critically injured. He's got bilateral, almost complete traumatic amputations. Very unstable. He needs surgical resuscitation.
Loudon is not a doctor who's only prepared to watch and wait.
You want to look over his shoulder?
Monitoring a junior colleague means getting involved, and his experience tells him something else needs to be done.
This needs to be driven into the operating theatre. They're going to intubate him, and they're intubating when he's unstable, which means he'll only get worse in the short term. You know, and he needs his legs off as soon as we get decent access.
Get that off. Arterial blood gas.
He was drifting in and out of consciousness. He was what we call peri-arrest. He was about to die. Yeah, I'm trying to push this through. This guy needs to be in the operating theatre.
Even though Dr. Loudon is not happy with the way things are going, there is little he can do until Dunning is sent to theatre by Dr. Guthrie.
In terms of hemorrhage, we've got 2 sites of major hemorrhage. They're controlled with thigh caps, and we're just getting a fast scan of his abdomen. Loz is doing that now just to see, because he was painful, was tender, was guarding of his abdomen.
He's obviously lost a lot at the scene. I mean, he's lost consciousness now, and in my view, it needs to be in an operating theatre in about the next 3 minutes.
And then we can think about the tourniquet.
Guthrie and his team have managed to stop the bleeding, and the rookie surgeon is determined to do everything he can to save Maureen Dunning's other leg. He wants Simon Lawrence to do an X-ray.
Let's give him a chance.
You look at the leg and it doesn't look too bad, and then when you look at the X-ray and you find that the bone has been completely mashed, and you know that leg's going to come off, and it does get a bit depressing sometimes when you know so many people are losing so many limbs, especially legs, because of mines and IEDs.
So then we can exclude blood in the chest, blood in the belly. The pelvis is stable. It's long bones. Okay, long bones, and he's resuscitating. I don't want any surgeon chopping off my leg because he thinks that's probably the right thing to do. I want him to cut my leg off because it's the only option, either to save my life or because my limb is completely unreconstructible.
Okay, Hugo, your haemoglobin is 12.9, your pH is 7.271. After you've done the fast, we'll drop the tourniquets down and then we'll sort out the theatre part.
So I'd like to roll this guy now.
What is the point of readjusting them here? There's an operating table ready. This guy needs to lose both legs in short order. It was a very simple assessment. This leg was dead, and this patient was also going to join the leg if we weren't very careful in terms of getting things done quickly.
The debate about what's best for Maureen Dunning is gathering momentum.
Plan operatively in terms of. I just want to sort of so we know which direction we're going in. Are you going to run? 2 tables are going to run, or not?
We've asked for the second team to come in.
Okay.
So it gives us that option.
The most senior surgeon in the hospital is now involved, Colonel John McMaster, another NHS volunteer who's a trauma consultant from Oxford and one of the world's leading experts on limb injuries.
I think what we need to do is complete our assessment on this guy first.
Are you happy with that?
Are you happy with this guy's stability? Because, I mean...
Yeah, sure. Stability's got, we've got control of the hemorrhage, so there's no rush now. Okay? There's no active bleeding. Okay, we've got the opportunity to fully assess with X-ray, to know exactly what we're dealing with, because that will make a difference to our management.
Well, we might as well use the time in X-ray then.
Okay.
I'm not comfortable, as you can see.
And neither is Maureen Dunning. He's taken a turn for the worse. He's bleeding again.
The tourniquets are not controlling it. This guy's bleeding out from his legs.
Doctors Guthrie and Loudon don't have much time. Within the next few minutes, they must decide what is best for their patient and end the debate once and for all.
In these circumstances, you just have to make sure that you save the guy's life.
In southern Afghanistan, the doctors and nurses in Camp Bastion's ER are still fighting to save the life and limbs of the 22-year-old Royal Marine who was blown up by a Taliban landmine, Peter Dunning. His doctor, Major Guthrie, is determined to try and save Dunning's right leg. He's already lost his left foot. Dr. Guthrie is working with Lieutenant Colonel Loudon, one of Britain's most experienced general surgeons, who's not convinced that this is the right course of action, or that Guthrie can win the battle of life versus limb.
He's a young, fit soldier who had a heart rate of 155. His normal resting heart rate is probably 50, so he's at the absolute limit of his tolerance. He's already lost consciousness, so clearly, that means the circulation to his brain wasn't good enough. He's got catastrophic lower limb injuries, and it becomes a point where it's very much limb versus life. We can remove the limbs and hopefully save his life.
Lieutenant Colonel Loudon is determined to have his way.
Right, let's stop and move into the operating theatre. Decision made. Yeah. Coming through. We're going to save this guy's life. That's what. About it, taking things in slow time, getting proper views. This guy's bleeding out from his legs, and the tourniquets are not controlling it, and this moving backwards and forwards. I've been saying for the last 5 minutes he needs to be in an operating theatre as soon as the lines are in. His legs, I mean, they're non-salvageable in any circumstances, but in these circumstances you just have to make sure that to save the guy's life. No British soldier has died on my watch because of limb injuries, and that's the view I hold firmly.
Lieutenant Colonel Loudon's watch extends beyond making sure Dr. Guthrie is doing the right thing.
Well, a bit better.
It involves scrubbing up and helping amputate, making do with a makeshift surgeon's cap of bandages.
See if there's anything else major going. Answer is probably not. So, you know, we've got a potentially very viable flap there. Okay, we've got a bit of muscle. And yes, so try and come outside that and not read about it.
While the doctors finish their work, Nurse Jones is trying to make sure Dunning has enough blood to survive.
That's his 8th as far as I'm aware, 8th in theatre, and he had more than that before he came in as well, so fair amount.
He's very stable now, alive, he's clotting.
Slowly does it.
I think we have to assume that this guy...
We've done our bit now, and he's got to live with that for the rest of his life, so that's quite hard, really. I was quite alarmed by how much it affected me. I've got images in my head now of him coming in and him losing limbs and things, and you just think, what would I do? You know, what would I do if that was me?
Well, it's just another young man with no legs. It doesn't really matter how it happens, it's just, you know, I mean... It's just very sad. Mind you, he nearly died, so that's not a bad save.
Three and roll, and back.
On the front line in Musa Qala, 55 kilometres northeast of Bastion, one of the Army's full-time combat medics, Lance Corporal Tom Story, is hard at work in his makeshift first aid post. This time, the casualty isn't a British soldier, but an Afghan policeman who shot himself in his leg.
Okay. I think he's lost a lot of blood on that because I've seen.
You doing his BP, are you?
Yeah, I've done it.
Story and his team are working in an old garage. No state-of-the-art hospital ER for them.
What kind of weapon was he shot with? AK, right, okay.
Right, it's alright.
1, 2,
careful as you do, just do it slowly.
There we go, got you.
See, take that out.
The wound might be self-inflicted, but the risk of bleeding to death is the same.
Yeah, you're in. Right.
Lance Corporal Story isn't only concerned about the amount of blood his patient is losing, he's noticed something else.
Go and grab that box from underneath there.
Tell him to look straight up.
Wait, pass agora.
No, look up. Pinpoint pieces.
Oh, the stoned out your tree, ain't you? These are all classic signs for which I'll take it. It's quite a chilled out bloke. Suspect he's got pinpointed pupils. Might have had something.
The something could be heroin. 90% of the world's raw opium comes from Afghanistan's poppies. Local cops with guns and hard drugs is not good news.
Dad, keep your legs still. Naughty, naughty man. I know it hurts, but you shouldn't have shot yourself in the leg. Hey, one, behave yourself.
He was fighting us all the way, and I couldn't understand why.
Stay still.
He was all the time becoming very agitated, and he didn't want us to treat him. He was rolling from left to right.
That's you. Oh. What's he saying now? He looked at me, shaking his head. Maybe I won't stop his bleeding then.
Which, for someone who's trying to fight you when you're trying to treat them, is, you know, you're just thinking...
Tell him that we're going to put something in his leg to help stop his bleeding, okay? It's going to be a bit uncomfortable, but it's for his own good. 1, 2, 3.
Yeah. No, hang on. 2 seconds.
Got it.
Get it in. Get it in. Get it in. Get it in. Good lad. Apply direct pressure. Good lad. Well done.
The policeman might be losing the hearts and minds of his medics, but he's still in a bad way and in need of a doctor to inspect his wound.
Just going to put something in that hole. Yeah, I want to have a look at it. I want to see the size. Okay. Quite deep, yeah. It's got his gastrocnemius muscles got. Right, we need to.
Dr. David Cooper is a full-time Army captain. His diagnosis means the policeman will have to be flown to Camp Bastion for surgery to stop the bleeding.
He's here tonight and he's going to go up tomorrow with the quick reaction force in the morning.
When they're not fighting the Taliban, Britain's armed forces spend most of their time keeping fit. Or at least the soldiers do. The doctors and nurses aren't quite so keen. So the Ministry of Defence offers a reward. Pass a personal fitness test and you qualify for a bonus of up to £1,500, tax-free.
As a 43-year-old male, I have to do 35 press-ups, 37 sit-ups, and my mile-and-a-half run in 12 minutes.
Captain Lawrence and his friend, Nurse Hawkins, haven't managed to pass their tests. It's not an NHS requirement, but they've now decided to give it a go and see whether they can collect the bonus.
It is actually tomorrow morning, so we've only got this afternoon to train, and we're both working. We've got to chill, we've got to relax, be in the right mental frame of mind to do it tomorrow.
You forgot to mention was the 800-metre warm-up prior to the mile-and-a-half run.
Oh yeah, I forgot about that. It starts at 05:30 in the morning. What's the O stand for? Oh my God, it's early! Yes.
It's not only Hawkins and Lawrence who are trying to pass the test. Nurse Jones is also doing her bit. And as an NHS physio, she's fitter than most.
I think TA sometimes is very difficult to maintain a full-time job and be as fit as someone who is in the regular army, who gets time set aside to do that fitness.
Yeah, I'm a physio, so I've got to give a good impression, I guess. I've not failed one, so I don't intend to now.
However, Captain Lawrence isn't making the progress he needs.
Given that I work back home in an oncology cancer hospital, it's a bit embarrassing to admit that I smoke, but I do.
Inside the hospital, Marine Dunning is still in intensive care.
He's got an IO on his right shoulder, that can come out.
But he's now out of danger, waiting to be flown back to Britain with his colleague, Marine Goddard. In Musa Qala, a heavily armed convoy is about to risk a run through enemy territory. They're not taking on the Taliban, but evacuating the Afghan cop who shot himself to a safe haven where the military air ambulance will fly him to the hospital at Camp Bastion for an operation to save his leg. Dr. Cooper's seeing him off.
We're travelling at first light to FOB Edinburgh, where there's a secure helicopter landing site, so therefore the Merc can come out and take this patient back to Bastion for surgery that he requires on his left lower leg. It's a little bit bumpy for the patient, but we've given him a good dose of painkillers and stuff, and he seems quite comfortable. I'm happy with his obs. So at the moment everything's going fine, as I would like it to go. So 1, 2, 3. All right, and down. All right.
Coming up the ramp now. Oh, our ramp's coming up. Okay, that looks good to everybody.
Every time the medical emergency response team flies, it's estimated it costs Britain at least £40,000.
Will you put something in?
It also puts the helicopter and the lives of its crew in mortal danger. As the shot policeman heads for Bastion, Dr. Cooper heads back to the first aid post with the mail the convoy brought in. For Lance Corporal Story and his medical mates, this is the first news from home for some time.
What have we got? Salt and vinegar?
The biggest
bit of morale you can get is having mail through. It's definitely a big boost. You hear what's going on back home, and it takes you away from the place you're in.
Dry roasted peanuts, mega. Quavers, hula hoops, Pringles.
Oh, GQ.
Whey!
It only takes a few minutes to get to Bastion by air. It's been 18 hours since the policeman shot himself, and once again, Dr. Guthrie and his team must try to save a man's leg.
So a bullet can pass through fat or muscle without really inflicting a huge injury. And the other thing that bullets do is cavitate. The temporary cavity expands and then collapses, and as it expands it sucks in debris and dust and other matter from the outside, which is why we have to get rid of all the dead injured tissue and all the contamination within the wounds.
Yeah, I'll just put a couple of stitches in.
The policeman is lucky. He keeps his leg.
So once you've done your closing and dressing, that's it, is it?
Yeah.
Meanwhile, Marine Dunning, who lost both his, is on his way home. Like all seriously injured British troops, he and Marine Goddard are being airlifted to a hospital in Birmingham for further treatment. With them goes the body of Marine Dale Gostick, the driver of the vehicle Dunning and Goddard were in, who died instantly when he struck the landmine. The flags fly at half-mast as the senior British commander in Afghanistan, Brigadier Mark Carlton-Smith, pays tribute to the dead Marine.
The credit belongs to the man who strives valiantly, who at best knows in the end the triumph of high achievement, and who at the worst, if he fails, at least fails daring greatly.
For those left behind in Afghanistan, there's still much to do.
11:28.
Can Lawrence and Hawkins win their bonus? While in the UK, Marine Dunning relives his worst nightmare.
I looked down and saw that I had no feet.
Dawn, Camp Bastion. For Captain Lawrence and Lieutenant Hawkins, it's the day they've been dreading, the personal fitness test.
Okay guys, the test's going to start in 4 minutes. Right, we'll start bang on 1:30.
An opportunity to win a £1,500 tax-free bonus, but also a chance to make a fool of yourself, especially if you are a weekend warrior.
If you're fit and you're used to doing that kind of thing, and you run anyway, it's fine. You don't have a problem with it. But if you don't keep that up through the year, it becomes an issue when it comes to trying to pass to get your bounty.
This is race prep.
Lawrence and Hawkins want the bounty, but they're rank outsiders.
It's been nice to know you, mate. Yeah. All that good stuff. Yeah. Strength and honour.
The money gets paid if you manage to achieve certain fitness challenges and run 2.5 kilometres within a time limit.
If you don't achieve the standards, if you don't put the time in, you won't get your bounty. It's quite important from a fiscal point of view that we actually do it. It's the stick that goes with the carrot, really.
Press-ups are easy for some.
Stop! Stand up!
Sit-ups are tricky for all.
Stand! Don't count them.
It's still only 5:45, but the temperature's rising rapidly.
We did our press-ups and sit-up at 5:30 in the morning, so we could start our run by 6. But it's still blooming hot at 6.
Lawrence and Hawkins must complete the 2.5 kilometres in under 12 minutes.
The times aren't easy. It's actually quite quick to do a 1.5 miles. So there are some people that struggle.
After 3, 1, 2, 3, slide.
In the hospital, the Afghan policeman is recovering from the operation to his leg. Anaesthetist David Kelly has already been told that he's a tricky customer.
Salam. Salam. Open your eyes on the board. Okay. There we go. There's the salam, salam. Come on, lie down. Tommy's going to injure his leg if he thrashes about. Let's get him back to the ward. He can go.
The policeman will be discharged to a local Afghan hospital
He's going to fall.
as soon as he finds his feet.
Just relax.
In the camp compound, Nurse Jones has completed her run, 2.5 kilometres in under 12 minutes. Bonus time. The same cannot be said for her fellow NHS volunteers.
11:28.
Come on, good effort, kick on.
12:30.
12:35.
If they wanted Olympic athletes, they'd employ, Olympic athletes.
No, not in time.
It's not only the loss of the bonus that hurts.
I made a valid effort and I kept improving. I mean, my times were improving, but never quite cracked it.
As the best friends go back to work in the battlefield ER, they take some comfort from the medical successes of their tour of duty. Over the 2 months they've been in Afghanistan, they've assisted in 17 emergency operations, during which limbs have had to be cut off. Amputations which, to the certain knowledge of the doctors and nurses, have saved lives, which otherwise would have been lost.
It's an end-to-end joined-up trauma care system, and it's producing results which I think really would be the envy of many major hospitals in the UK national health system.
If a patient makes it alive to the hospital, there is a very strong presumption that they should survive.
We, the United Kingdom, have a responsibility to our soldiers. If we're going to send them to these places, they need to be looked after.
4 months after he was almost killed by a Taliban landmine, Marine Peter Dunning is recovering well at a military rehabilitation centre in southern England, and starting to remember what happened to him when he and his mates went after the Taliban.
We didn't really want to stop and try and pick a fight because we couldn't see them at all. They were just pinging off, getting close, and a couple of times I heard a few cracks going past my head and that, so it was quite a hairy moment. Not knowing what's in the ground ahead here, you just have to hope and pray, really. I can't remember anything about it. A couple of lads have been told I got blown clear of it because I was on top cover. I've got no idea how bad it was, what state the wagon was in or anything.
Speak to me. Yeah, okay, good man.
Come in a second. What is the point of readjusting them here? There's an operating table ready. This guy needs to lose both legs in short order.
I would have said I was doped up all the time, yeah, on morphine. I was on ketamine as well, which is a horse tranquilizer.
He's losing consciousness and you're to intubate him.
I looked down and saw that I had no feet and everything. It hit me pretty bad. I couldn't sit up, couldn't do anything. I was just lying on my back all day long, which obviously, from being a fit person like I am to lying on my back doing absolutely nothing was quite hard, really. And I was at Camp Bastion, and I had my company sergeant major, standing at the end of mine and my friend's bed, and I was talking to them. That's when I found out that my driver had unfortunately died. Dale Gostick did die in the incident, and unfortunately I couldn't get to his funeral. But the lads have said that they gave him it was a good send-off. They gave him a good send-off, and they had a good few drinks afterwards as well to celebrate Dale Gostick's life.
Slowly does it. 1, 2,
I'm a lot better from what I was. A lot more at ease with the whole thing now, really. I always keep as positive as I can. As far as I'm concerned, this is just a setback to me, and I'm sure I'm going to get up as strong as I was and as fit as I was, if not fitter.
For Peter Dunning, the next stage in his recovery will be the fitting of artificial legs and learning to walk again.
Stop what you're doing.
Next time, on the front line with the combat medics.
This is the first time I've been anywhere which could be on the edge of my comfort zone.
Picking up the pieces.
Hughes here has sustained a fracture to his right ankle.
Saving lives.
This is going to hurt.
He's a fighter. He's fighting.
And treating the Taliban.
I find it harder to go in and treat him as normal.